And a very good morning to you. Welcome along to our special question and answer session for students at the University of Essex. It's just after 9:15. My name is Simon Morgan. I'm Associate Director of Communications for the three CCG's clinical commissioning groups across Suffolk and North East Essex. Really good to be here, and I'm really pleased to welcome to you and to introduce you to you rather our panel of experts today. And for that, I'm going to introduce first of all Lisa Nobes. Lisa, would you like to introduce yourself, say who you are and your job title, please?
Hello there, I'm Lisa Nobes. I'm Director of Nursing for North East Essex CCG, and I'm the lead for our clinical lead for our vaccination programme.
Thanks, Lisa. Danny.
Thank you. My name is Danny Scholl. I'm a consultant in public health working with Essex County Council.
Thank you. Lara? Lara's on mute.
Sorry. Hi, my name is Lara Carmel. I'm the Director of Workplace Health, Safety and Wellbeing. I manage the Occupational Health Service and Clinical Lead on campus.
Thank you, Lara. Nicola.
Hello, my name's Nicola King. I'm Professional Lead for Occupational Health at the University of Essex.
Thank you, Nicola. Debbie? Debbie's on mute.
My name is Debbie Back. I work at the University of Essex in the HSC placements team.
Thank you, Debbie. And Nandra.
Hi, good morning. My name is Karandeep Nandra. I'm one of the registrars in public health working at Essex County Council. I work very closely with Danny Scholl.
And it would be great if you could put your camera on as well, if that's possible. Thank you very much indeed. And Stuart Hentley.
Hello there, my name's Stuart Henty. I'm COVID-19 testing and vaccination lead, University of Essex.
Lovely. Well, thank you very much indeed for joining us today. We're going to get straight into the questions this morning, of which there are many, and we're going to invite each of the panel members to answer the questions. So let's get on with the first question that we've received from you. And don't forget, if you have a question that you'd like to put to our panel, please do email studentoh@essex.ac.uk. That's studentoh@essex.ac.uk. So first question then, let's put this one to Danny. How safe are the vaccinations?
Thank you. Yeah, so the question was that has this been adequately researched? And if you think about it, that makes sense as a question. We went from never knowing this particular virus to having a vaccine that's effective against it within 12 months, which is pretty unheard of for a vaccine. So to go from nothing to having an effective vaccine in 12 months does make people think, well, surely there was some shortcut, surely something was done that isn't quite safe. And there are a couple of things I'd like to say about that. Firstly, that the reason that the vaccine was brought out so quickly is that the technology has moved on. Don't know if people remember the Ebola epidemic in West Africa a few years ago. That galvanized the vaccine researchers, and they were able to develop new technologies or bring on new technologies that helped to develop vaccines faster. And very early on, it was realised that this was going to be a worldwide emergency. So governments were ready with the finances, and that's one thing that often stops vaccines being developed, is the amount of money that is needed to research and develop them. Drug companies also saw the priorities to get a vaccine out, so that led to the willingness of the companies to produce vaccines and to try and research and develop vaccines. Then there was no shortage of volunteers. It often takes a long time to recruit people for vaccine trials, but because of the urgency and the need was evident for this disease, then there were lots of people willing to partake in the research that was done to start with. And thirdly, there was a great deal of this virus around, and what you need to do is you have to have enough people infected with the virus so that you can see the difference between those who've been vaccinated and those who haven't in a controlled trial. That's part of the research, so that you can see that the vaccine is better than not having the vaccine. All those things came together so that we were able to develop the vaccine much faster. There was no breach in the normal procedures for the developing the security and testing the safety of the vaccine before it was brought out. So that was the research phase. Then it was brought out. After the post-production, safety relies on things called the yellow card system, where any safety issue, any possible association with the vaccine is reported by the clinician or even by the patient themselves, and that's then monitored to make sure that there's no safety issues. That's how we found out about those very rare side effects, which we'll probably be coming on to later, such as the blood clots or the inflammation of the heart muscle. So those were found out from the research, but we're happy to say that this is a very safe vaccine, and we've seen that it's been given to millions and millions and millions of people worldwide. So it's not as if there's going to be a rare side effect that we haven't come across that is of any significance. So we can be very reassured that this is a very safe vaccine, and I put my money where my mouth is in that I've had both vaccines and a booster, as you would expect somebody in my position. Thank you.
Thank you very much indeed, Danny, and I can certainly echo that. Any other comments from other panel members at all? Okay, thank you very much. Let's go on to the next question. This one's for Lisa. Is having to have the vaccine to work a breach of my human rights? Is having to have the vaccine to work a breach of my human rights? Lisa.
Thank you. That's a great question. So the Human Rights Act, I'm not a lawyer, but the Human Rights Act supports people's ability to make choices about their life. And I believe that you have the choice to make a decision around whether you work in health or social care, which is where the requirement to have COVID vaccine is being mandated. So I suspect it doesn't breach your human rights. In health and social care, we have a duty to protect people under our care, and we've been very used to, those of us that have worked in health, to having to have our hepatitis B vaccination programme to protect people under our care, and this is of the similar position that we know people who are unvaccinated are more likely to transmit COVID to vulnerable people, and because our patients and residents, if we work in health and social care, tend to be vulnerable, we know that there is a greater risk. So that's why it's been introduced for health and social care workers, but you have a choice as to whether you work in health and social care. So I think the easy answer to that is that it doesn't breach the Human Rights Act.
Thank you very much indeed, Lisa. Don't forget to keep your questions coming in, studentoh@essex.ac.uk, and we'll pick those up in the chat as well. Delighted to also welcome this morning Dr. Frida Barty, who's on the panel as well. She's just joined. Particularly grateful to her because she is on call at the moment. So Frida, you're very welcome, and perhaps I can level this next. We can hear you. We can hear you.
And I think, yeah, I'm on call and I'm keeping an eye on my triage list as we're here, so I might have to go off at some point. So I'll stay as long as I can. But thank you for having me.
Fully understand and very grateful. Thank you. Perhaps I can ask this question of you, Frida, if you don't mind. I've had the COVID-19. I've had COVID-19 already, so have the antibodies. Do I therefore need to have the vaccine as well? Frida, what's your response to that?
My response to that would be yes, but from a medical perspective, you have some natural immunity, there is no doubt. I mean, I'm presuming this is a young person, but the point about it is that you can still, the virus, particularly Omicron, is showing some what we call natural immunity escape, which means that even though you've got natural immunity, it doesn't necessarily mean that you won't get COVID, particularly this new variant, in terms of its ability to overcome natural immunity. So I would suggest that it is still very important to be vaccinated with the full primary course if you haven't been already, and then boosted at the time of eligibility, depending on your age, at a later date, to protect yourself and those others, because even though you have it, and yes, you do have some antibodies, that doesn't preclude the fact that you could still transmit a new infection to others or even be ill yourself.
Thanks, Frida. We've had a follow-up question that's come in. Does the vaccine protect us against the new Omicron variant? Is that something you'd be able to pick up as well, please?
Yes, and the data's still coming out on that, and Daniel probably knows that as well. But the data so far is showing that the 3 doses of Pfizer, I think that's the data so far is on Pfizer and Moderna. They're probably going to assume the same for Moderna. 3 doses, that's your primary course, and your booster is protected against Omicron. That's why booster is so important, because whilst there is vaccine escape and the level of vaccine escape isn't known, but the worst case scenario I've read so far is about 70%. Which means, you know, that the Omicron can overcome the vaccine immunity in 70% of people, basically, or potentially. Therefore, the booster boosts those antibodies to protect you from the possibility of the vaccine that you've had not working as well as it could because your immunity's waned. Does that make sense? Daniel probably knows a little bit more than me on current data.
Danny, is there anything else you'd like to add at all, please?
I think that covers it nicely, but I'd just like to just quickly add that there are 3 things we often consider when we look at the effectiveness. So there's or maybe 4, the effectiveness of stopping you actually getting the infection in the first place, then the effectiveness of stopping you passing it on to somebody else, the effectiveness of stopping you get an illness that is so severe that you go into hospital, or so severe that you die. So those 4 different levels, and the Omicron has some means of defeating the immunity, but the vaccination is still effective at all of those levels. So it's less effective than it has been for the predominant strain that we've had before, the Delta virus, but it is still effective. So it's a very useful. But what you want to have is to have maximum immunity. That's why we're pushing out as hard as possible the booster in those people who had the vaccine early on, who might be particularly vulnerable to bad outcomes. So I'd agree exactly with what Dr. Frida said.
Okay, thank you very much indeed. Any other comments from any other panel member at all? Lovely, thank you very much. I'm just getting some questions over to Frida because I'm aware that she's got to dart off in a second. So the next question, Frida, might the vaccine affect people more from minority ethnic groups? And also there's a follow-up question here. I'm worried about blood clots risks resulting from the AZ vaccine due to hormonal contraception. What would your response be to those 2 questions, please?
Okay, first of all, I'm just going to first question is ethnic minorities. There's no evidence as far as I know, and again, Daniel will confirm this, but there's no evidence as far as I know that ethnic minorities are worse off with the vaccine. In fact, it's incredibly important for the very reason they are ethnic minorities and demographically, in some cases, socioeconomically more vulnerable. Therefore, they should absolutely be vaccinated. So it's quite the opposite of the question, really, is the answer, is that it's actually a very, very vulnerable group that needs to be vaccinated and boosted. And secondly, AZ, well, the blood clot situation has been fairly well documented at the moment, I would say, and we are where we are with AZ, but we're not boosting with AZ. We're boosting with Pfizer and we're boosting with Moderna. So to backtrack and start discussing AZ and contraception is rather retro, really, if I'm honest with you. The conversation should be have your booster with Pfizer or Moderna. Forget about AstraZeneca now. Get your booster done with the other 2 vaccines. That's the message.
Thank you very much, Frida. Any other comments from any other panel members at all? Danny?
I'd like to just add that the very rare side effect that can happen with a blood clot is not related to the oral contraceptive pill or anything like that. So there's no other risk factor that you can predict that puts somebody at increased risks of the AZ. So if you're taking the oral contraceptive pill, it's no more dangerous to have the AZ than if you're not taking the oral contraceptive pill.
Can I just come in there as well and say that none of the vaccines are dangerous for anybody taking the contraceptive pill whatsoever?
Thank you very much. Thank you. 2 questions here, which I'm going to take in as one, if you don't mind. The first part of the question is, I'm worried about the Pfizer vaccine due to its links with heart issues. And the second part to it is, will there be lasting effects from regular COVID-19 vaccinations? We've spoken about the safety of vaccinations, but there's a question here about any possible long-lasting effects from the regular COVID-19 vaccinations. Who would like to pick those two questions up, please?
Daniel.
Danny.
Thank you. Yeah, I'm very happy to take those. So as I said, it is a safe vaccine, very safe. Could I say that it's 100% safe and there's no possibility of side effects? Well, obviously not. There's nothing in this world that is 100% safe, but it is very safe. The very rare things that can occur are the blood clots we've talked about, particularly associated with the AstraZeneca vaccine, and inflammation of the heart muscle, myocarditis with the Pfizer and probably Moderna as well, which is very rare but can occur. Normally is a short-lived unpleasant symptom of cardiac chest pain and settles down without any problems. So that's the predominant problem with the Moderna and the Pfizer. You've got to also think that we're not talking about the vaccination in isolation. You can compare this with the outcomes and the risks of actually the wild infection with the SARS-CoV virus that causes COVID-19, and that causes myocarditis and lots of other, so inflammation of the heart and lots of other health conditions as well. Even if you don't get admitted to hospital or lose your life as a result, it can have long-term consequences. So that's, you've got to always bear that in mind. I've often been asked, well, how do we know this? We've had this program rolling out for just a year, so how do we know that there isn't going to be 5 years, 10 years from now some kind of side effect that we would wish we had known about? And you can never look into a crystal ball and know the future, but what I can say is that with previous vaccinations and problems with vaccinations, they've always become apparent in the weeks after the vaccine. So that long-term consequences of having had a vaccine is not a factor that we've seen before, and it's not impossible that this will be the first set of vaccines that occurs in. However, the chances and history seems to show that that's unlikely to be the case. Then you've got to consider the infection itself, the SARS-CoV, the virus. We know that's a multi-system disease, that it affects all parts of the body. If somebody were to tell me that actually 5-10 years down the line from now, we're going to see a wave of illness as a result of this virus, I wouldn't be too surprised. I would be shocked if it were a result of the vaccination there. Thank you.
Okay, thank you, Danny. Question here for Lisa, I think, actually. Why would I need the vaccine if I am fit and healthy? Why would I need the vaccine if I am fit and healthy?
Well, because if you develop COVID, you may not be fit and healthy when you get COVID, if I'm honest. Being fit and healthy is great and may reduce your risk somewhat, but it doesn't mean to say that you will be fit and healthy with COVID. And we know, obviously the effects of long COVID. So don't be kind of sucked into thinking because you're fit and healthy you don't need it. I've got a number of people in our intensive care units in Suffolk and North Essex who are in the 20 to 30 age bracket who were fit and healthy but have not had the vaccine and unfortunately are now in critical care. We know we've got a number of young people in our system who 7 months after having COVID, it's a great thing if they have the energy to put their socks on. So being fit and healthy is great, but it does not protect you against getting seriously ill from COVID. It may reduce the risk of you getting seriously ill, but it doesn't protect you 100%. So only the vaccine can help to boost your protection.
Thank you very much, Lisa. Danny?
I just wanted to quickly, I agree with everything that Lisa said, but another point that Lisa made earlier, which is that the vaccination is to protect the vulnerable people who you might be caring for. So you could pays your money, takes your choice, as it were, for your own risk, but actually it's the risk of other people as well that need to be considered. Even if you're fit and healthy, that doesn't stop you contracting it and passing it on to somebody who might be less fit and less healthy. Thank you.
Lovely. Thank you very much indeed. Any other comments from panel members? Frida?
Yes, can I just add that following on from what Lisa said, and Danny, that you are protecting those around you. which is vital. But also I am now seeing cases of long COVID in young people as a GP, and the reality of long COVID is deeply unpleasant. And whilst it's not obviously that this is a few cases, I've not seen a lot in my own practice, but it is deeply affecting one's functionality. And when you're young in your 20s, you don't want that. You don't want that at all, but you don't want to be laid down with long COVID. And people have such variability of long COVID as well. It's a real spectrum of symptoms and disabilities, if you like. Some people are, like Lisa said, unable to get out of bed. Some people have real mental health problems from it as well. So it is deeply affecting long COVID, and unfortunately long COVID is affecting the younger community as a cohort. And again, Danny will probably be able to confirm that or not, but as far as I can see, long COVID is more affecting in my practice of the young people.
Thank you, Frida. OK, I think we've got lots of questions coming in now. I don't think we're going to have time to answer any more questions, so perhaps we'll just get through the ones that have been posted in the Q&A, and also Stuart's been popping them in the chat facility as well. The next question relates to healthcare students getting the third booster vaccination before going to placement. Can they do that? And if yes, how do they register? I am an international student. Perhaps this is a question more for the university. Is that something, Lara, perhaps you or your colleagues might be able to pick up at all?
We can certainly pick up that with the vaccination teams, and obviously if it's been 3 months since the second vaccine, they'll be entitled to have that booster now. And the green books have been updated, so we should be able to administer those at our vaccination clinics. So if that is affecting you, do write into the inbox, and we'll make sure you know when the next vaccination clinics are available.
Thank you, Lara. Next question is, what's your interpretation on the vaccine's effectiveness at reducing transmissibility against the new strain, as it seems it is having minimal effect in slowing infection rates down? Lisa, is that something, or perhaps Danny might be able to answer that? Danny?
I'm going to put that onto my public health colleague.
OK.
Thank you. I'm very happy to take that. There's a lot we've yet to learn about the Omicron variant and its interaction with the vaccines, but it does appear that the vaccine is particularly effective at stopping people being admitted to hospital or dying as a result, but less effective at stopping people being infected. And less effective at stopping them passing it on, which is why this strain is being passed so rapidly in the population. However, there still is an effect, so it's a reduced effect, but it still reduces the chances of an individual passing it on to somebody else. So it's the best tool that we have at the moment. Would I like to have a better tool? Oh yes, of course I would. I'd like to have something that stops it so that you couldn't possibly give it to anybody. We don't have that. This is the best thing we've got to slow down and to help protect the vulnerable.
Thank you very much. OK, we've got a couple of questions here from Fran. Fran, thanks for your questions. I'm going to direct these to Frida. Frida, if you don't mind answering them, I'm going to take them as two questions in one set of questions. So the first part of the question is it okay to mandate a vaccine that results in death? And the second part of her question is, vaccination doesn't prevent infection or transmission, so why are they being mandated?
First of all, they're not being mandated, I think that answers that question. It's not mandatory in this country at the moment. It is still a choice. We are encouraging people to be vaccinated, in particular if they've been vaccinated, to be boosted as soon as possible once their eligibility comes up, because whilst yes, as Daniel said, it doesn't necessarily reduce transmissibility as much as we like with this particular new variant, it does reduce infectivity, or certainly the impact on hospitalizations and death in people. So I think in terms of my real point here is we're in a pandemic. We all have a duty to each other as well as to ourselves, and as a society. And I do believe that. And I've never experienced a pandemic in my career, and I hope to God I never experience one again. But I will say this, that in a pandemic, we do have a duty to each other. And whilst it's not mandated, I would take that duty to society incredibly seriously, as well as to my own health.
Thanks, Frida. Any other? Danny, you've got your hand up.
Thank you. So if I can just add to that, so the only place where it is mandated is that if you are working in a care home, then you have to be vaccinated in order to. So you don't have to be vaccinated. You could choose to change your employment to something else. However, obviously the people being cared for, they have a right to life, and that the vaccine will not only reduce the risk of death to the person who's vaccinated, it reduces the risk of death to the people they come into contact with. So it is reducing that risk of death, which is why it was brought in. But in this country, we are only mandating it in areas where there's a clear need to do so, unlike other places. And I do like to avoid mandation if at all possible. I think from a public health point of view, because when people are backed into a corner, they often don't react well and feel very challenged. So we're being as least restrictive as possible.
Thank you, Danny. There was one or two comments about mandatory, so I think you've covered those off nicely there. I'm going to skip through some of these questions only because of time, and I'm conscious that we've got our clinical colleagues here for a finite amount of time. So if I can perhaps take the next question, which is about placements. Do we need to have our booster for placement? I'm double vaccinated and do not want another. So is that something perhaps for the university to perhaps take up with students outside this meeting?
Yes, we certainly can. At the moment, we know they need to be double vaccinated to go on placements, but I haven't seen evidence about boosters yet. Lisa, can you have you seen anything? Yes, or Danny?
Yeah, so I can just jump in there. So the legislation is all about being fully vaccinated, which means having had 2 vaccines.
Yeah.
It doesn't mention the booster. So I'd really like to have a dialogue with the person who's worried about the booster, because I'd like to explain why it's in their own best interests, but it's not mandated, so they don't have to have it. But I would strongly encourage anybody to get the booster as soon as they can.
Thank you, Danny. Next question is, what is in the vaccine? Who will be able to answer that one? What is in the vaccine? Danny?
Yes, certainly. So it does depend on which vaccine you're talking about, but the three they have different delivery mechanisms, the AstraZeneca, the Pfizer and the Moderna, but the important thing in all of them is what's called mRNA, messenger RNA. So this is the instruction to produce a protein that gets put into the muscle cells of the person who's vaccinated. So it goes into your arm. The vaccine, the mRNA is incorporated into the cells of your own body, and your body makes the particular protein that's found on the virus. So it's called the spike protein that everybody would have heard of. This is something the immune system can identify and get ready to attack whenever it sees anything coming on with the spike protein. So then you're infected with the virus, your immune system recognizes the spike protein on the virus and kills it. So that's the way it works. It's not nothing infectious is injected into the person, so you cannot get any infections from it. It's only the messenger mRNA, which is rapidly metabolized by the body, so that then disappears, and all that is left is the immune response to be able to attack the spike protein when it's seen on the virus.
Okay, thank you very much indeed. We are trying to get through as many of these questions as we possibly can. Those questions that we aren't able to answer, we will try and get responses to you. Nisha's asked, are we still protected even if we have done the 3 doses because of the new virus? So are we still protected even once we've had the 3 doses? So Danny.
Thank you. Yes, so I think we've covered this a little bit before, but yes, you are protected. The degree of protection is less. So people often say, well, I had the vaccine, I've had the virus, therefore I wasn't protected. Now, it doesn't give 100% protection, so it's still possible to be infected, but it does give you still protection. And if you've had both vaccines and you're fully boosted, then you've got the best protection that we can give you.
Thank you very much. Any other questions at all, or any other answers relating to that? The next question is, are the volunteers who are given the vaccine trained and instructed to give the vaccinations. So is that a question maybe for Lisa?
Yeah, sure. So the majority of people giving vaccines are registered professionals. So yes, and those people who are not registered nurses or paramedics or doctors that are giving the vaccine have been through a full training program and have had their competencies assessed. So please don't worry about that. We've put everybody through a really rigorous training program.
Okay, if there are any other members of the panel who want to jump in, please do so, because I'm having to look at questions on a different platform now. So please do jump in. The next question is, there have been 30,000 women who've come forward to say that their cycles have been disrupted since having the vaccine. This affects future fertility. How do I know I will be able to have another baby in the future if I have the vaccine in light of this information? Who would be able to pick that question up? Please jump in.
So please, anybody else jump in if they want to add to this, but if I can just take that. So I would be surprised if it's only 30,000 women who have reported a disruption of their cycle, because menstrual cycles and their disruption is quite a common factor, can happen for any number of reasons, and can happen sometimes with no identifiable reason. So it's a very common symptom. It's been recognised on the yellow cards, that system that I mentioned for looking at side effects. It doesn't show infertility or future infertility, the disruption of the cycle. There is no reason to suspect that the vaccines that we have at the moment would interrupt the normal fertility in either the female or the male. There is also no plausible biological mechanism by which it could. And although this isn't great evidence, if I can just say that when they were doing the AstraZeneca trials, they asked the people who were being vaccinated not to fall pregnant, because they were at that stage, they weren't sure of the safety of these vaccines. But actually, more people fell pregnant in the vaccinated group than the non-vaccinated group. So there's absolutely no evidence of any fertility problem, and there's also no theoretical reason why there should be. I also know of no vaccine that is effective at stopping the future fertility. So it really is a complete red herring, but it does show that as soon as somebody makes a suggestion, it's very difficult to prove a negative, and it's been going around, and it's caused a great deal of anxiety with absolutely no basis to it.
Okay, thank you, Danny. Anybody else want to come in at all?
Can I just make a point, Simon, which is I completely agree with everything Danny said, but if you are not vaccinated pre-pregnancy, obviously you can be vaccinated pre-pregnancy, during pregnancy, but if you don't get yourself vaccinated, the risk that you potentially put your baby in. So we know that people who develop COVID during pregnancy, particularly in their last trimester, the last 3 months, the rate of poorer neonatal outcomes for their baby is higher. We know that more babies are admitted to neonatal units. We know that more babies are born smaller and earlier. So please, when you're making that decision, please consider the safety of your baby if you choose not to get vaccinated pre-pregnancy.
Can I come in and just add to Lisa and Danny? I agree with everything that they've said, but also pregnant women are at high risk of COVID. So let's not forget the pregnant cohort of women. So turning it around again, please get vaccinated if you are pregnant.
Thank you, Frida, and thanks to the panel. Question here or comment. I'm seriously anxious about having the vaccine as I am breastfeeding and cannot find any information about this at all. Hopefully we've answered and given you some reassurance there. We have had a live Q&A session fairly recently, actually. In fact, we've had 2 in the last few months about this particular subject. So if you want to watch the recording of that, please do visit www.snevaccine.org.uk and you can find the recording there. Okay, lots of other questions that are coming. I think we're going to take these questions away. We'll get answers to those because we are running out of time. Are there any final comments at all from panel members or indeed from colleagues at the university? And I think Stuart wants to come in as well to talk about a clinic that he's got arranged with on the campus. So first of all, to clinical colleagues, any final thoughts or comments at all? Frida, anything from yourself?
Just say, please get boosted.
Thank you, Frida. Lisa or Danny?
You know, it's tricky, isn't it? This is a really big decision for people, and we really understand that. But you know, you have some really intelligent people on this call that are telling and asking you to get your vaccine. So please take our advice and get your vaccine. Thank you, Lisa. And Danny, anything from yourself at all in the way of a final word?
Just very quickly, it's a great resource that you've got in these vaccines that can protect you and protect those around you. So if you're not going to take it up, have a really good reason for not doing it, and explore that reason. Don't just take one source of information. Look around, check around, and just see what you think is the best course of action for you. Thank you.
Thank you, Danny. I'm going to come to university colleagues next, just to see if they've got any final comments or anything that they want to share on this call. Lara, first of all.
So firstly, I want to say thank you to all of the panel to help us today to come here to answer these questions. If students are still concerned, please do write to Occupational Health, email OH, and we can speak to you as well in Occupational Health about these vaccines and the implications of placement. We do have a vaccination clinic next week on the 15th of December, so you can still book in for that clinic on campus. We are seeing, sadly, rises in cases on campus at the moment in Colchester, significant rises in cases, and we are seeing those that have had the vaccine are still getting COVID. We're not seeing anyone that's boosted that has got COVID on campus at the moment, but we are seeing some very sick students that haven't had the vaccine. So please just keep that in mind as well as Christmas approaches as well. Thank you.
Thank you, Lara. Anything else from other university colleagues at all? Nandra, Nicola?
Just reiterating what Lara's saying, really, that if any student has got any specific concerns and they want to discuss that with a clinician, then we are here and they can email us and we can, you know, sort of take up those queries.
Thank you, Nicola. Anybody else at all? Please do come in.
Just to add that with regards to the clinic that's occurring next week, we are trying to book as many people in as possible. It's the last clinic of before we break up for Christmas, and if you wish to book for your vaccinations or your boosters, you can email covid19@essex.ac.uk, and in your email, if you can just provide your current vaccination, your COVID-19 vaccination history, just to help the team. And we're trying to get as many people. We've had a huge increase in the sort of the turnout over the last coming weeks, and we'll book you an appointment and get you done next week. Thank you.
Thank you very much indeed, Stuart, and thank you to our panel. Thanks to Frida as well. Thanks to everyone for joining. Frida, any last minute comments from you? I think you have said something already, but was there anything else you wanted to add at all?
No, I just think that it's good to have concerns. It's good to question as well. I just want to add that I think it's really important that you are, you are able to express those concerns, and you know it's good to question the whole programme, but really read on the scientific element of it. Look into the kind of good reports, the people you trust. I say to my patients all the time, try to just, when you're looking and Googling, and it's absolutely great to do that and to research it. Please look at good, viable, good sites that have the information. There's a lot of stuff out there that perhaps, as Danny said, is not quite correct. And please try, to make that decision based on good data.
Thank you, Frida. Very, very wise there. Thank you. Well, look, that's all we've got time for. Thank you for joining us today. Thanks to the panel members. We will have a recording of this event available to you. And as I say, we will come back to you with answers to questions that we weren't able to answer on this particular session. So thank you very much. Have a good day. Enjoy your weekend and enjoy Christmas when it comes as well. Take care. Bye-bye.
Thank you.
Thank you.